tous. Bonjour à tous. Hello, everyone. Yesterday, we marked 1 year since the pandemic officially began. No matter who you are, getting through the last 12 months has taken strength. It has taken courage. But above all, it has taken hope. There are still many days to go in this pandemic, but each one that passes, just like each person who gets a vaccine, brings us closer to the better days ahead. À ce jour, on a livré plus de 3,8 millions de doses de vaccins contre la COVID-19 aux provinces et aux territoires. On va recevoir des millions d'autres doses d'ici la fin du mois. Et à partir d'avril, on va en recevoir encore plus rapidement. Cette semaine, l'équipe du major général Fortin au Centre national des opérations a coordonné un exercice de répétition avec les partenaires de l'industrie ainsi qu'avec les partenaires fédéraux, provinciaux, territoriaux et autochtones. Cet exercice était afin de s'assurer qu'on soit prêt pour la phase d'accélération des livraisons. Toutes les ressources sont mises à contribution. Hier soir, on a eu notre 28e rencontre des premiers ministres. On a marqué avec une déclaration conjointe cet anniversaire solennel et les héros qui travaillent depuis les tout débuts pour nous garder en santé. On a reconnu les familles qui sont en deuil, les gens qu'on a perdus à cause de la COVID-19. Et on a souligné encore une fois l'importance de continuer à travailler ensemble, continuer d'être là en équipe pour tous les Canadiens d'un bout à l'autre de ce pays. Nous allons continuer de le faire. Nous allons continuer d'être là pour vous. Based on new delivery schedules from Pfizer, I can confirm that Canada will receive at least 1 million Pfizer doses per week from March 22nd to May 10th. 1 million doses of Pfizer alone every 7 days. That's going to make a big difference. We have shared these updated delivery schedules with the provinces and territories. This is so they can continue to plan for mass vaccination sites to get you and your family protected as soon as possible. Every dose makes a difference. Last week, Susan from DDO in Montreal wrote to me to say that she and her husband, who are both seniors, had gotten their first dose. She told me about the relief they felt after a year of worrying. Susan, je suis content de savoir que vous et votre mari soyez enfin plus en sécurité. Comme j'ai dit, tous les gens qui le veulent vont pouvoir se faire vacciner avant la fin septembre. Une des meilleures façons de se protéger contre le virus, c'est de se faire vacciner. Et pour les personnes déjà vaccinées, c'est important de continuer de faire sa part pour assurer la sécurité des autres pendant qu'on continue à augmenter les vaccinations. L'hiver a été long. On attend tous le printemps avec impatience. En tant que Canadiens, avec nos grands espaces, on aime ça passer du temps à l'extérieur. Dans la dernière année, surtout après des journées de réunion sur Zoom, il y a beaucoup de gens qui ont redécouvert à quel point c'est agréable d'aller se promener dehors ou sortir avec les enfants à vélo en fin de semaine. C'est important de pouvoir sortir et de se déplacer. C'est pourquoi, au cours des 5 dernières années, on a fait des investissements partout au pays, dans des projets comme le Kelly's Brook Path à St. John's et le Grouse Mountain Trail à Vancouver. Ces projets ne visent pas uniquement à créer des sentiers de randonnée ou des chemins accessibles en fauteuil roulant jusqu'à l'arrêt d'autobus. Ils permettent à tout le monde de se déplacer. Ils nous aident à bâtir des communautés plus saines et plus fortes. Et sur ce front, on a franchi une nouvelle étape aujourd'hui. As Minister McKenna announced earlier this morning, we are investing $400 million for bike lanes, trails, and pedestrian bridges across the country. This is part of our historic public transit investment over the next 8 years and our plan to create 1 million jobs. This will lead to stronger communities, clean air, and new jobs. And that's a win-win. And that's our blueprint to come roaring back from this pandemic. As we rebuild from this crisis, it's up to us to create the kind of Canada we all want to see. A country where everyone has what they need to succeed. Right now, one of our top priorities is ensuring that no one misses out on vaccines. This includes Indigenous communities, which are particularly vulnerable to the virus. Vaccination is underway in over 530 Indigenous communities and communities in the territories. And for Indigenous people living in cities, we're working with the provinces and territories to get everyone their shots as soon as possible. Of course, keeping people safe and ensuring communities have the resources they need doesn't end with vaccines. And on that front, this morning, I want to talk about where we are with long-term drinking water advisories. Earlier this week, we marked an important milestone in our partnership with First Nations communities, the lifting of the 101st long-term drinking water advisory since we took office. Thousands of homes now have clean water. That's real progress, but I know that there is more work to do. As Minister Miller has said, we will not stop until everyone in every community has access to clean water. Finally, I want to end this morning on the news that the Canadian economy gained 259,000 jobs, both part-time and full-time, in February. For the workers who are back on the job and for the families, this is the good news they need. Every step of the way, our focus has been on supporting Canadians through the storm. But let's not forget there are still far too many people for whom things continue to be really tough. If that's you, know that you're not alone in this crisis. We're here to help you get through it and get back on your feet. That's exactly why we are extending the Canada Emergency Wage Subsidy and the Canada Emergency Rent Subsidy and Lockdown Support at their current levels until June, as I announced earlier this month. For places like the Hamilton Conservatory for the Arts, the wage subsidy has been the difference between having to shut down or keeping people on the payroll. And it's the same story for millions of workers right across the country. Quand on a créé la PCU en mars dernier, je me souviens de vous avoir dit qu'on allait vous apporter le soutien dont vous avez besoin au moment où vous en avez besoin. Ça n'a pas changé et ça ne changera pas. Ensemble, on va s'en sortir. Merci. Et je passe maintenant la parole à la Dr. Tam.
Dr. Tam, the floor.
Bonjour à toutes et à tous. Today, we'll start with a numbers update, closing out a week of remembrance with renewed commitment to the efforts that we shape our future. Today, there have been 899,757 cases of COVID-19, including 22,371 deaths and over 30,670 currently active cases reported across Canada. And over the past week, an average of over 3,050 new cases and 31 deaths were reported daily. At the same time, over 2,050 people with COVID-19 were being treated in our hospitals each day, including about 540 in critical care. To date, close to 3,000 variants of concern cases have been reported across Canada, with the B117 variant accounting for over 90% of these to date. During the past year, and in the lead up to yesterday's National Day of Observance, I received many notes from Canadians sharing their reflections on the year that was, including the heartbreaks and the lessons that were revealed along the way. To all those who have lost loved ones during a year when we could not ease their passing or memorialize their lives as we would have, I extend my deepest sympathies. Though difficult times have passed without them, the day will come when we can gather again with friends and family to honor their memory and celebrate their lives. As vaccine programs continue to escalate, more than 2.7 million doses of vaccines have been administered across Canada. Over the past week, provinces and territories have administered close to 600,000 doses of COVID-19 vaccines, which is the highest number of vaccines administered in a single week since vaccination began in mid-December. We're making progress every day, and as the snow melts and the first day of spring is just over a week away, I know that we're all anxious for the finish line on this long marathon. But right now, racing towards the finish could cost us the success we've worked so long and hard for. Right now, we need to run the mile we are in and keep to a steady, cautious pace. Let's all continue to support Team Vaccine by not providing any opportunities for Team Variant to gain more ground. Before I close, I would like to say a special word of thanks to incredible public health workforce in this country and around the world. Dedicated people, too numerous to count, have and will continue to work tirelessly behind the scenes, not just since COVID-19 was declared a pandemic, but in the lead up, during, and long after. From those who test and trace at the local level, to those who bring us the latest numbers and pour over emerging evidence that shapes and adapts our guidance across every area of the response, thank you. This is truly the largest, most complex response in the history of public health, and the public health workforce in Canada has been dedicated to giving their best efforts every day. On behalf of all these quiet heroes, I dedicate my closing public health message. Please remain vigilant, follow public health advice, and keep up with individual practices that protect us and our families. It is up to you plus public health. Thank you.
Bonjour à toutes et à tous. Nous commencerons aujourd'hui par les derniers chiffres, alors que nous achevons une semaine de commémoration où nous avons renouvelé notre engagement à l'égard des efforts qui façonneront notre avenir. À ce jour, il y a eu 899 757 cas de COVID-19 au Canada, dont 22 371 décès. Il y a maintenant plus de 30 670 cas actifs au pays. Au cours de la dernière semaine, plus de 3 500 nouveaux cas et 31 décès ont été signalés en moyenne chaque jour. Pendant la même période, plus de 2 050 personnes atteintes de la COVID-19 ont été traitées dans nos hôpitaux chaque jour, dont environ 540 étaient aux soins intensifs. Jusqu'à présent, près de 3 000 cas de variants préoccupants ont été signalés au Canada et le variant B117 représentant à ce jour plus de 90 % de ces cas. Au cours de la dernière année et pendant la période ayant précédé la Journée nationale de commémoration qui s'est tenue hier, de nombreux Canadiens nous ont écrit pour nous faire part de leurs réflexions sur la dernière année, notamment des chagrins qu'ils ont éprouvés et les leçons qu'ils ont retenues pendant cette période. À tous ceux et celles qui ont perdu des êtres chers au cours d'une année où nous n'avons pu apaiser la douleur laissée par leur disparition, ni commémorer leur vie comme nous l'aurions fait en temps normal, nous vous offrons nos plus sincères condoléances. Malgré les moments difficiles passés sans eux, le jour viendra où nous pourrons nous réunir de nouveau avec nos amis et notre famille pour honorer leur mémoire et célébrer leur vie. Alors que nous exécutons plus rapidement les programmes de vaccination, plus de 2,7 millions de doses de vaccins contre la COVID-19 ont été administrées au Canada. Au cours de la dernière semaine, les provinces et les territoires ont administré près de 600 000 doses de vaccins contre la COVID-19, le plus grand nombre de vaccins injectés en une semaine depuis le début de la vaccination à la mi-décembre. Nous réalisons des progrès chaque jour. Alors que la neige fond et que nous sommes à un peu plus d'une semaine de l'arrivée du printemps, nous savons que nous sommes tous impatients de franchir la ligne d'arrivée de ce long marathon. Toutefois, à l'heure actuelle, courir vers l'arrivée pourrait nous coûter le succès pour lequel nous avons travaillé si dur et si longtemps. À l'heure actuelle, nous devons nous concentrer à franchir la distance qui nous reste à un rythme constant et prudemment. Continuons d'appuyer l'équipe des vaccins en ne laissant aucune chance à l'équipe des variants de gagner du terrain. Avant de conclure, nous voudrions remercier tout particulièrement l'incroyable personnel de santé publique ici au Canada et ailleurs dans le monde. Des personnes dévouées, trop nombreuses pour être comptées, travaillent sans relâche dans les coulisses depuis que la pandémie de COVID-19 a été déclarée. Elles le faisaient également avant la pandémie et continueront de le faire longtemps après. Des personnes qui s'occupent du dépistage et de la recherche des cas à l'échelle locale jusqu'à celles qui nous communiquent les derniers résultats et qui se penchent sur les nouvelles données probantes en vue d'orienter et d'adapter nos directives sur tous les fronts de l'intervention à la pandémie. Nous vous remercions. Il s'agit véritablement de l'intervention la plus importante et la plus complexe de l'histoire de la santé publique. Et la main-d'œuvre en santé publique au Canada s'efforce de faire de son mieux chaque jour. Pour tous ces héros discrets, nous concluons par ce message de santé publique. Restez vigilants, respectez les directives de santé publique et suivez les pratiques individuelles qui nous protègent, nous et nos familles. Nous comptons sur vous et sur la santé publique. Merci.
Merci beaucoup, Dr. Njoo. On va commencer la période des questions aujourd'hui avec le premier ministre pour 20 minutes avec une question et une sous-question. Les ministres et les docteurs resteront disponibles par la suite pour un autre 20 minutes. En commençant par le téléphone. Thank you, Dr. Njoo. We will start questions with the PM today for 20 minutes, one question, one follow-up. The ministers and doctors will remain available afterwards for another 20 minutes. Starting with the phone, en commençant par le téléphone. Opérateur, c'est à vous.
Thank you. Merci. For questions on the telephones, please press *1 on your device's keypad. Pour toute question au téléphone, faites *1 sur votre appareil. La première question, Marie Vastel, Le Devoir.
First question, Marie Vastel, Le Devoir newspaper.
Oui, bonjour, Monsieur Trudeau.
Hello,
je voulais
Mr.
revenir
Trudeau.
sur ce que vous avez dit ce matin en entrevue à CTV sur l'idée d'un passeport vaccinal. Vous avez semblé faire une distinction entre un passeport pour l'international puis un passeport qui serait requis pour certaines activités domestiques, si je peux dire. Vous semblez évoquer en fait qu'il y aurait une question de charte et de droit en parlant d'égalité. Est-ce que c'est ça le problème? Et du coup, est-ce dire que vous excluez l'idée d'un passeport vaccinal au niveau domestique?
Je n'exclus rien, Marie. Je pense que nous allons voir comment les prochains mois vont se découler, comment on devrait s'assurer et un certain retour à la normalité en même temps en protégeant les Canadiens le plus possible. Mais on voit très clairement qu'il y a deux enjeux par rapport à des certificats ou des preuves de vaccination. Un, ce serait cette idée qu'on aurait besoin d'une preuve de vaccination pour voyager à l'international. Ça fait longtemps que ça existe déjà. Il y a des pays dans le monde où il faut démontrer une preuve de vaccination contre certaines maladies tropicales, par exemple, pour pouvoir aller dans ces pays-là. Donc, c'est déjà bien établi et c'est quelque chose que les pays explorent activement et le Canada fait partie de cette réflexion. Mais quand vient la question de distinguer à l'intérieur de notre propre pays sur certaines personnes qui se seraient faites vacciner et d'autres qui ne pourraient pas ou ne choisissent pas de se faire vacciner, il y a des questions d'équité et de justice par rapport à la discrimination qui pourrait être introduite. Je comprends qu'on veut motiver et encourager tout le monde de se faire vacciner. C'est la façon par laquelle on va passer à travers cette crise. Mais il faut réfléchir à ceux qui, à cause de réalités médicales, à cause de circonstances, ne peuvent pas ou n'ont pas pu se faire vacciner. Il faut avoir une pensée pour la justice et pour l'équité dans toutes nos réflexions. C'est ce que je souligne depuis le début. Mais ces conversations se poursuivent évidemment. I think it's obviously important to highlight that we want to encourage and motivate people to get vaccinated as quickly as possible. Getting as many people vaccinated as quickly as possible is the way to restore a semblance of normality in the coming months. And of course, we're going to make decisions step by step and look at all sorts of different ways, both to encourage people to get vaccinated and keep people safe. The idea of certificates of vaccination for international travel exist already and are well established. There are countries in the world where you shouldn't go unless you can prove that you've been vaccinated against certain tropical diseases, for example. That's well established. But the idea of certificates of vaccination for domestic use to decide, who can go to a concert or who can go to a particular restaurant or engage in certain activities does bring in questions of equity, questions of fairness. There are some people who, because of medical conditions or other reasons, will not be able to get vaccinated. There are others who are not on priority lists who will have to wait much longer before getting vaccinations. These are things that we have to take into account so that, yes, we're looking to try and encourage everyone to get vaccinated as quickly as possible, but we're not discriminating and bringing in unfairness in the process at the same time.
En suivi, Marie?
Oui, en fait, vous avez un peu juste répété la réponse de ce matin à TV. Donc, ce que je veux savoir, c'est s'il y a un risque de discrimination. Donc, pourquoi est-ce que vous n'excluez pas un passeport vaccinal au niveau domestique? Et puis, ma question de suivi, parlant de ne rien exclure, sur la possibilité d'élection, vous avez aussi dit que vous vouliez continuer de travailler pour gérer la pandémie jusqu'à ce qu'on ait traversé cette crise pour tout le monde. Je vous cite une traduction un peu bancale, mais c'est ce que vous avez dit. Donc, est-ce que vous excluez maintenant qu'il y ait une élection tant que tout le monde n'est pas vacciné? Sinon, c'est quoi votre critère quand vous dites on veut attendre d'avoir traversé la crise? Quel est votre critère avant de tenir une élection?
Je comprends, Marie, que les partis d'opposition et les journalistes parlementaires passent beaucoup de temps à penser à des élections. Moi, je passe pas beaucoup de temps à penser à des élections. Ma priorité, c'est la COVID-19, c'est cette pandémie, c'est de rebâtir l'économie le plus rapidement et le plus efficacement possible. C'est ce sur quoi nous travaillons et nous allons continuer de travailler.
Opérateur, prochaine question au téléphone.
Thank you. Merci. Next question, Charlie Pinkerton, iPolitics. Line open.
Good morning, Prime Minister. There was a story in the New York Times yesterday about tens of millions of doses of AstraZeneca's vaccine that's sitting in American facilities. And that's because the states themselves, they haven't approved the vaccines. They're not being used. But the Biden administration won't approve their shipment to the European Union. Has your government reached out to the Biden administration about Canada being able to access these?
Over the past weeks and months, we have engaged with all different vaccine companies, with all of our allies to talk about getting more doses to Canadians as quickly as possible. Those conversations will be ongoing. We will continue to look to get as many Canadians vaccinated as quickly as possible so we can keep people safe and bring our economy roaring back. Those conversations will continue with everyone. Depuis des semaines et des mois, nous parlons avec toutes les différentes compagnies de vaccins et nos alliés et partenaires à travers le monde sur notre désir de vacciner les Canadiens le plus rapidement possible pour qu'on puisse ramener notre économie et protéger les gens le plus rapidement possible. Ces conversations, évidemment, vont continuer.
Following up.
With respect, Prime Minister, you did not directly address the question. Have you spoken to the Biden administration or anyone in your government spoken to the Biden administration about freeing up these tens of millions of doses of AstraZeneca vaccine that are sitting in American facilities?
Over the past number of months, we've had lots of great engagements with the American administration on COVID-19, on working together to keep people safe, on vaccinations, on border measures. Those conversations with the Americans will continue, as they do with all our partners. Au cours des derniers mois, nous avons eu beaucoup de conversations, incluant directement entre moi et le président Biden, sur la COVID-19, sur notre coopération et collaboration, sur le besoin de faire vacciner nos citoyens, notre besoin de continuer de protéger les gens par les mesures frontalières. Et nous allons continuer d'avoir ces discussions.
Merci. Opérateur, dernière question au téléphone avant de passer dans la salle.
Thank you. Merci. Prochaine question, Catherine Lévesque, La Presse canadienne. À vous.
Catherine
Oui,
Lévesque,
bonjour,
La Presse
Monsieur Trudeau.
canadienne.
Je voulais
Question.
revenir sur
I'd like to
votre
come
rencontre avec
back
les
to your
premiers ministres
meeting
des
with the
provinces et des
first
territoires
ministers
hier.
of the
Je voulais
provinces and
savoir s'ils vous ont
territories yesterday.
directement redemandé en fait une
I'd like
hausse
to
des
know
transferts en santé de
if
28
they
milliards de
have
dollars et qu'est-ce que vous leur avez
I know
répondu? Est-ce
that
que
they
vous leur
asked
avez
for a
confirmé finalement que ça
$28
ne se
billion
retrouverait pas
health
au prochain budget?
transfer? What did you answer
D'abord,
to?
on continue d'avoir de
We
très bonnes
continue to
rencontres
have very
avec
good
les premiers
meetings
ministres.
with
C'était
the
notre
first ministers
28e
of provinces and
rencontre des premiers
territories,
ministres hier
first of
soir,
all.
Catherine, puis
This
je
was our
peux
28th
souligner que ça a
meeting,
été
and I
une
can
conversation
tell you
extrêmement
that we
positive,
had a
mais
very
qui
positive
était
conversation.
évidemment
It was
concentrée
obviously
sur ce
focused
sombre anniversaire que nous
this
marquons d'un an
unfortunate
depuis
anniversary,
le
the
début de
one-year
la
anniversary
pandémie
since the
et
beginning
sur le
of the
travail que
pandemic.
nous faisons ensemble pour
And
assurer
the
que
work that we are
maintenant
all
et dans les
doing
semaines à
together
venir,
to ensure that in
les
the weeks to
Canadiens
come,
reçoivent
Canadians
l'appui,
will
le
receive
soutien
the support
et les vaccins nécessaires pour passer à
vaccines
travers.
that they need to
On a
get through
parlé
this.
des différents,
spoke
des différents processus de vaccination, de
various
l'augmentation
vaccine
des moyens de vaccination,
procedures,
de
how to
l'augmentation
increase the average,
des vaccins qui arrivent.
how to
Et je
increase-
leur ai rappelé
increasing the number
que nous
of
avions
vaccines
été là
arriving.
pour appuyer les
And
provinces et
I told them
territoires,
that
comme on
we
a
are
été là
here
pour
to
appuyer
support
les
the provinces
provinces,
and
les
territories,
citoyens
as we are
depuis les
also
débuts de
here
cette
to support
pandémie et par rapport aux
citizens,
coûts
Canadians, and
supplémentaires
have
à
been
cause de
since
la
the beginning of
pandémie
this pandemic.
liés au système de santé, nous allions
As for
continuer
health
d'être
funding
là
questions,
pour appuyer les
we are
provinces.
going to
Par
continue to
rapport
supporting
à l'avenir
the
long
provinces and
terme
territories.
de notre système de
As for the
santé,
long term
j'ai souligné encore une fois
and
que
our healthcare
nous allons
system,
avoir ces discussions une fois qu'on
we will
passe
be having these
à travers cette
discussions once
crise
we get
ponctuelle
through this
et que je
temporary
reconnais que nous
crisis.
allons avoir besoin
I
d'augmenter les
recognize that we
transferts en
need to
santé pour le long terme.
increase healthcare,
Mais maintenant, avec les dizaines de milliards de dollars qu'on a envoyés aux provinces, on va continuer d'assurer que les gens ont les ressources pour aujourd'hui et demain
great deal of
pendant
money
cette
and funding
pandémie.
already to the provinces, and we want to
Suivi,
ensure
Catherine?
that people can get through this pandemic.
Oui, donc
Follow-up
j'en
question?
comprends que donc le sujet a été abordé.
I understand then that the question was
Et je voulais
discussed,
aussi
if
vous
I read
demander
between
pourquoi
the
on n'a
lines.
toujours pas de
Why
date
is
de
it
budget.
that we still
Pourquoi
don't
qu'on attend
have
jusqu'en
a
avril pour
date
dévoiler
for the
un
budget?
état
Why are
des
you
finances
waiting
du pays?
until
Vous pensez pas que
April
les Canadiens
before
devraient
releasing
savoir
a
un peu
financial
avant
statement,
la
economic
mi-avril?
statement? Don't you think
Depuis les
Canadians would like
débuts
to
de
know
cette
more?
pandémie, on a
Answer.
été extrêmement
Since the very beginning of this
transparent
pandemic, we've been
avec
very
les investissements qu'on fait pour
with regard to the
appuyer
investments
les familles,
we
les
are making
travailleurs,
to support families,
les
workers,
provinces et les territoires.
provinces,
On va
territories.
continuer
We're
d'être
going to
extrêmement
continue to do
ouvert
so.
avec le fait
We'll be
qu'on est
open
là pour
about
appuyer
the
les
fact that we're
Canadiens
here
avec
to
tout ce que ça
support
prendra,
Canadians.
aussi longtemps que ça le prendra.
We'll provide what
C'est
is
la
needed
promesse qu'on a
for
faite
as
aux
long as
Canadiens.
needed, as is
On va
needed.
dévoiler
That's
la
the
date du
promise we've made to
budget
Canadians, and
dans
we'll
les
reveal the
semaines à
budget
venir, mais
date in the
les
weeks to
Canadiens
come.
peuvent avoir confiance
But
que
Canadians
notre approche,
can be
c'est d'être là
confident
pour
that our
investir
approach
dans nos
is to be
communautés
here
et
for
dans
them to
la
invest in
réussite et la
communities
sécurité des Canadiens.
and to
Ce n'est
ensure
pas
that
l'approche de tous les
Canadians
partis
succeed
politiques. On voit
and
un
are safe.
grand débat
This is
là-dessus
not
avec les
every
conservateurs
political
qui disent
party's
qu'on en fait
opinion.
trop
The
rapidement.
Conservative
Ça va
Party is saying
certainement
that we're
être des
doing too much,
conversations
too
qu'on va
quickly.
avoir autour du
These will
budget.
surely be
Mais je peux vous dire
conversations
que
that will have a
déjà les
gain when
bonnes
it comes to
nouvelles
the
qu'on voit
budget.
par rapport à la
But
reprise économique, c'est
we have
lié au
had
fait
good news with
qu'on a
regard
fait
to
des
the
investissements pour
economic
s'assurer que
recovery,
les Canadiens
and
puissent
that's
passer à
related to the
travers
investments that
de la
we've
bonne
made
façon de
to
cette
ensure that
pandémie.
Canadians can get through this crisis
Merci. On va
in the
maintenant
right
passer
way.
aux questions dans la salle.
We'll go to questions in the room now.
Mr. Trudeau, my name is Mal Hamidian with the Canadian Press. You have talked repeatedly over the last half year or so about building back better. And you have also you had actually to repeatedly hold off on bigger picture plans in favor of extending temporary measures and programs to help Canadians through the pandemic. What economic or other markers are you looking for in switching from crisis response to bigger picture recovery?
Well, I think everyone knows that we have to get through this pandemic. We have to make sure that Canadians are safe. That is the top priority of this government, and that will continue to be the top priority of this government. At the same time, we recognize that one of the best ways of ensuring that our economy comes back strongly, comes roaring back as we get through this pandemic, is to make sure we're giving Canadians the right supports throughout this pandemic. That's why we made a simple promise. We'd be there for people as long as it took, as much as it takes. And that's what we're going to stick with.
Next question in the room.
Same, Mr. Trudeau, Chris Nachkite, CTV National News. President Joe Biden last night said Americans are going to be able to have a July 4th barbecue because every American will have their shot by then, a somewhat return back to normal. When are you going to formally change your vaccination timeline for Canadians?
The big vaccination timeline that we have been talking about for a long time now has always been the end of March. And we had a goal of vaccinating or getting 6 million doses into Canada by the end of March. We're now looking at over 8 million doses by the end of March. So that is good news. We have also made repeated commitments to Canadians that everyone who wants to get vaccinated will be vaccinated by September. That continues. But in my conversation with the provinces last night, we heard from a number of people who are looking to have everyone received a first dose earlier than that. We will continue to work with experts, work with the various provinces, and do everything we can to get everyone vaccinated as quickly as possible so we can get back to normalcy as soon as possible. Nous avons toujours parlé de deux cibles spécifiques en matière de vaccination. D'abord, fin mars, on avait parlé de 6 millions de doses qui seraient livrées au Canada. On parle maintenant de plus que 8 millions de doses qu'on va avoir au Canada avant la fin mars. Et l'autre cible qu'on visait, c'est d'assurer que tout le monde puisse se faire vacciner avant la fin septembre. On est tout à fait enligné pour ça, mais je peux souligner qu'à parler avec les différentes provinces hier soir, on a entendu qu'ils ont des espoirs de pouvoir vacciner beaucoup de gens, au moins avec une première dose avant la mi-été. Donc, on peut espérer qu'on va pouvoir avoir des meilleures nouvelles dans les mois à venir, mais nous allons continuer notre travail pour assurer par tous les moyens possibles de vacciner le plus grand nombre de Canadiens le plus rapidement possible pour pouvoir revenir à la normale dès qu'on pourra.
Prochaine question.
John Perry, CBC. When Donald Trump even threatened to block PPE, there was an uproar in this country. And now you've got the Biden administration actually blocking shipments of vaccines. What do you think about that action by the Biden administration? And are you worried that this kind of response from the United States is going to threaten Canada's shipments of AstraZeneca vaccine?
None of the vaccines that we have been contracted for or promised to Canadians have been blocked either by the European Union or by the United States. We have signed significant contracts for tens of millions of doses that will be arriving in the coming months, and we are confident that there will not be interruptions to those vaccines. But it's one of the reasons why we have signed a more diverse portfolio than just about any other country for more potential doses per Canadian than for any other citizens in the world, because we knew that there was always a potential of challenges around that. That's how we make sure that we're going to be able to vaccinate as many Canadians as possible, as quickly as possible. On AstraZeneca, we have a contract for about 20 million doses this year, and we are looking forward to receiving a schedule on those doses, hopefully in the coming weeks. We will continue to work to get as many doses as possible, as quickly as possible for Canadians.
Là-dessus, s'il vous plaît.
Depuis les débuts, nous savions que nous devions signer différents contrats avec des différentes compagnies pour assurer qu'il y ait de la résilience dans notre chaîne d'approvisionnement, pour s'assurer que s'il y avait des défis ou des délais ou même des blocages en quelques endroits, on allait quand même pouvoir livrer des vaccins pour les Canadiens. Je peux souligner qu'aucun des livraisons de vaccins n'a été bloqué par l'Union européenne ou par les États-Unis ou par d'autres. Nous allons continuer de recevoir les vaccins qu'on a commandés et je peux rassurer les Canadiens à ce niveau-là. Je veux aussi souligner que par rapport à AstraZeneca, on a un contrat pour 20 millions de doses cette année. On espère qu'on va commencer à en recevoir bientôt de cette commande-là, mais nous attendons l'horaire de livraison, le calendrier de livraison le plus rapidement possible.
Bonjour, M. Trudeau, Louis Blouin de Radio-Canada. Vous dites qu'il y a 3 ans, vous n'étiez pas au courant de l'existence d'allégations contre le général Vance. Qu'est-ce que vous dites aux Canadiens qui regardent ça, qui se disent comment le numéro 1 de l'armée peut-il être ciblé par des allégations et que le premier ministre ne soit pas au courant? Au final, est-ce que M. Sajjan et votre personnel n'avaient-ils pas l'obligation morale de vous le dire? Puis, vous, est-ce que vous aimeriez pas être au courant d'informations aussi délicates que ça?
D'abord, comme vous savez tous, c'est extrêmement important pour moi que quiconque qui sert dans nos forces armées ou qui travaille dans la fonction publique ou n'importe où au Canada ait un environnement de travail sain, sécuritaire et ait des moyens de faire des plaintes et de se faire entendre s'ils subissent de l'intimidation, de l'harcèlement, de l'agression. Ça a toujours été une priorité pour moi et c'est quelque chose que mon gouvernement a toujours pris au sérieux. On a mis en place de plus en plus de mesures pour permettre et un changement de culture et pour créer des ressources et des appuis pour des gens qui viennent à l'avant. Mais une chose qu'on n'a pas fait et qu'on ne devrait pas faire, c'est de donner à des politiciens la responsabilité d'enquêter sur des allégations eux-mêmes. On a toujours besoin d'avoir des processus indépendants, rigoureux, qui font des suivis sur des plaintes et des allégations. Et c'est exactement ce qui s'est passé dans cette situation-ci. Le ministre Sajjan a encouragé, a dit à l'Ombudsman d'amener ces preuves et d'amener cette plainte-là à des instances indépendantes qui allaient pouvoir faire le suivi de façon rigoureuse. Et mon bureau était au courant qu'il y avait des plaintes qui avaient été dirigées vers des instances indépendantes. Mais ces plaintes n'ont pas pu avoir de suivi parce que l'information n'a pas été donnée. I think everyone knows how important it is to me that women and men who serve in the Canadian Armed Forces or anyone who works in the public service or anyone who works in any workplace across the country has a safe work environment and has the resources and the supports needed to come forward with any allegations of inappropriate or harmful behavior. That is something that we have taken significant steps on over the past number of years, but obviously there is much more to do, particularly given recent revelations about what's going on within the Canadian Armed Forces. The one thing that in all the different measures we've put forward to better respond to allegations and concerns is that we haven't given politicians themselves more tools to investigate allegations of malfeasance or wrongdoing. It's not for politicians to do that. It is for independent, rigorous authorities to follow up in the right way. And that's exactly what happened when the ombudsperson came forward to Minister Sajjan to highlight allegations that he had received about the Chief of Defence Staff. The Defence Minister, quite appropriately, said, I'm not the person who can investigate this. You need to go to the appropriate independent authorities who will follow up on this and take this very seriously. Our job as politicians is to make sure that these structures are there and that any allegations are taken seriously. This is what my office was aware of, that allegations were directed towards independent authorities. Now, it turns out that those independent authorities never received enough information to actually proceed with a full investigation, but that is something that is the right of people to come forward to who don't want to give more information. And we always have to walk that line very, very carefully, and as a government, we always have.
When we first broke the story on these allegations against General Vance, you and your office told us that you only learned of the allegations through our reporting. In fact, I think you may have said that in the House of Commons. But I think earlier this week or earlier on in the last few days, you yourself have since confirmed that your office did know 3 years ago of these misconduct allegations against Vance. So the first question is, why are we having such difficulty getting a straight answer on that issue? And then B, why 3 years ago? Why, it seems like your office, somebody turned a blind eye essentially to these allegations.
On the contrary, David, 3 years ago, when the ombudsperson came forward to the minister and said, I have received allegations against the Chief of Defence Staff, the minister, quite rightly, directed the ombudsperson to the independent authorities who could follow up and create that investigation. My office was aware that there had been allegations that were directed to the independent authorities. The substance of those allegations, the details of those allegations were not known by my office. Now, 3 years later, as these events come forward with details of what those allegations are, I and my office learned about them through the reporting and the questions posed by the reporters at Global News. Il y a 3 ans, quand l'Ombudsman est allé voir le ministre de la Défense pour dire qu'il y avait des allégations contre le chef de l'État-major, le ministre a, de façon extrêmement appropriée, correcte, dit tu dois amener ça à des instances indépendantes qui ont la capacité de faire l'enquête sur des allégations pareilles. Mon bureau était au courant du fait qu'on a référé ces allégations directement à des instances, mais on n'était pas au courant des détails de ces allégations. Et quand les instances appropriées n'ont pas pu faire de suivi sur ces allégations parce qu'il y avait un manque d'informations, l'enjeu n'a pas été revisité parce qu'il n'y avait pas eu de processus, il n'y a pas pu avoir de processus. Et donc, il y a quelques mois, quand par le travail de Global, il y a eu plus d'informations sur ces allégations. C'était la première fois que j'en prenais conscience et que les gens de mon bureau en ont pris conscience des détails.
How things unfold.
Good afternoon, Marika Walsh with the Globe and Mail. Prime Minister, you keep saying in your responses to this that the minister and your government directed these allegations to the independent authorities, but the Privy Council office does not have oversight over the military. So why do you keep saying they were the correct body to send this to when they don't have oversight over them?
Governor and council appointments, like the Chief of Defense Staff, have a line of responsibility that goes through the public service and indeed through the Privy Council office. We've seen a lot of discussions now about the appropriate investigative bodies either within the military or independent from the military. And these are all things that we're looking at very carefully in order to make sure that there are stronger processes in place to make sure that anyone who comes forward with allegations or concerns about misconduct of any type is properly heard, properly supported, and that we create a shift in the culture to make sure that these incidents aren't happening in the first place. And we have taken many, many steps since 2015, Marika, on delivering strengthened processes, better procedures in place. But obviously, there is more we need to do, and we will continue to do more. Évidemment, malgré tout ce qu'on a fait depuis 2015 pour augmenter les ressources et les façons de poursuivre des plaintes ou des préoccupations que les gens pourraient avoir, on a évidemment besoin d'en faire plus et nous allons en faire plus.
Merci beaucoup, Monsieur le Premier ministre. C'est tout le temps que vous avez avec nous aujourd'hui.
Merci beaucoup.
We'll now go back to questions in the room since we don't have any queue on the phone right now. Questions for ministers and doctors starting now.
Thank you very much. David Aiken, Global News. I guess I'll start with a question first for Minister Hajdu in beautiful Thunder Bay. Know it very well, like it, except for the cold in March. And maybe for Dr. Tam as well. This is from my colleague Eric Sorensen, who he was asking or noting that some epidemiologists now suggest that the new variants, should not be blown out of proportion, though modeling indicates they are more transmissible. So I wondered if I can get your thoughts then as spring arrives, Canadians are itching for a return to more normal life. Is there anything in the data that troubles you at this point? Do you expect a third wave? What can you say to Canadians about that, Minister Hajdu and Dr. Tam?
Well, thanks, David, and thanks for the shout out to Thunder Bay. I think I'll turn that to Dr. Tam, though it's a very scientific question.
Sure.
Yes, thank you so much. And we're constantly learning about variants as we're going along. And of course, we try to look towards other countries in the data, such as the United Kingdom and elsewhere, because they were ahead of us in terms of the knowledge. And so we take into account what we learned in that context. But of course, Canada is not the same as England and didn't have the same set of conditions. And we hadn't sort of loosened our measures and put on the brakes just around that Christmas sort of time period as well in many jurisdictions. So the context is a bit different. So we were anxious certainly to get some Canadian data on, how transmissible is this the variant. The predominant one, as I said in my opening remarks, is the B117. And I don't know if you've seen some of the Ontario data, but that's where a lot of the B117 variants are occurring. And the initial estimates in that context for the reproduction number is that is sort of over the 1.2 mark, whereas the current estimate for the reproduction number for the strains prior to that is now just under 1. So there is a difference in transmissibility, of course, between the B117 and the rest. And that might be a little bit lower than what we were seeing in the United Kingdom. But that's also because of the great work that people have been doing in the public health measures. As we see those public health measures ease, that reproduction number may well change due to a complexity of different circumstances. So I think it is really important still to be very vigilant about these variants. They are definitely more transmissible. I've heard accounts of actual outbreaks where the attack rate was that much higher with the B117 variant. Very difficult to stop once this starts. You've seen Newfoundland, what happened there in a jurisdiction that had things well under control. The other aspect of the variants that we are very concerned about, of course, is the impact on severity or serious outcomes. And there is increasing strength of evidence to show that the B117 variant, for example, can result in increased mortality and serious, outcomes such as hospitalizations and ICU use. So I think that as we watch this space really carefully, we might just see that in Canada. So we just got to be cautious.
Thank you very much. Follow-up is just for Minister Anand. Minister, earlier this week on Tuesday, we asked your departmental officials what we thought was a pretty basic question, which is, can you tell us where the current vaccines are manufactured? And they sent us an answer at 7:30 last night that there was no answer. So what we're looking for, and I think we've had some of this on the public record, but if you can go over it, what city and country is the Pfizer vaccine that we're getting manufactured in? What city and country is the Moderna vaccine that we're now getting manufactured in? And I know we're talking about where the J&J vaccine, where the AstraZeneca vaccines are coming from, but can you narrow it down rather than just Europe and America to the state, city, and country where the J&J and AstraZeneca vaccines are likely to come from? Are you able to do that for us?
Sure. Can I just clarify? Are you asking about all 4 vaccines or 2 vaccines? Because you mentioned all 4 in there.
I'm asking for all 4, recognizing that I think the last we heard, supply chain discussions are still underway for J&J and AstraZeneca, but feel free to update that. But obviously, we're getting Moderna and Pfizer right now. So we'd like to know the source of the facility where those are coming from. And then can you tell us that you must have some idea where the factories are that are going to make the future AstraZenecas, not the one coming from India, but the ones that AstraZeneca itself is going to deliver. That's what we're looking about. And then also, what plants is J&J thinking about to make the Janssen vaccine that is going to be coming our way in the 3rd quarter?
Okay, so I believe it is on the public record that our doses of Pfizer are coming from the Perth plant in Belgium. In addition, our doses from Moderna are coming from both Switzerland and Spain, given that the process of fill and finish occurs in a different country than the actual production. So again, we're getting product out of Europe. We've been able to get product out of Europe, and it's really important to note that despite kind of transparency mechanisms that the European Union is putting in place, we've been working with our counterparts and we're getting our product up out of Europe, and that will be 8 million into Canada prior to the end of March. In terms of the production of the two most recently approved vaccines, being J&J and AstraZeneca, I've previously indicated that the AstraZeneca vaccine will be coming from the United States. And in terms of J&J, actually, in my conversations with J&J as recently as this week, we are being told that there are multiple possibilities for the sourcing of the J&J vaccine, and we are still in discussions with them regarding where precisely the J&J vaccine will be coming from into Canada. Suffice it to say, though, that we are expecting delivery schedules from both AstraZeneca and J&J in the very near future. We have 10 million single-shot vaccines coming from J&J, 20 million vaccines coming from AstraZeneca. And in the meantime, because we have approval of AstraZeneca, we made sure to source additional areas of supply for that AstraZeneca vaccine. That was what led to the finalization of our Serum Institute deal for the AstraZeneca Covishield vaccine, a deal for 2 million additional vaccines of that sort on top of our 20 million AstraZeneca doses. So our strategy has been all along, you can see from my response just now, to diversify our supply chains, to ensure that Canadians can have product, have vaccines from multiple sources of supply, multiple suppliers, and multiple countries, so that we are not negatively impacted by any control restrictions that might be placed on us. And that's exactly what we're able to deliver for Canadians. That's the benefit of a diversified portfolio. And we are going to see those benefits manifested over the next weeks and months. As we know, over the month of April, we're on track to receive 7 million doses from Pfizer, Moderna, and AstraZeneca Covishield alone, with 1 million doses per week through mid-May from Pfizer. So that is a very steep ramp up in our vaccines importing into Canada, and we're going to continue to see large numbers in vaccines coming to this country, 36.5 million doses prior to the end of June and 118 million doses prior to the end of September. Thank you.
Thank you. We'll now go to the next question in the room.
There's Marika Walsh with the Globe and Mail. Minister Hajdu, I'm wondering if you can tell us when you first learned there were allegations against the former Chief of Defense Staff, Jonathan Vance. Was it in 2018 as well, or was it more recently, and if so, when?
I wasn't aware of allegations until the information was present in the media just recently.
How your government handled the allegations in 2018. Do you feel that more specifics needed to be brought forward for the government to act, or do you believe that simply knowing that there is an allegation could have or should have prompted a review?
Well, thank you, Marika. I have no reason to doubt the appropriateness of the actions that were taken by my colleague, Minister Sajjan. And of course, having been the minister responsible for the legislation around harassment and violence in the workplace, of course, it is difficult to investigate allegations without details. So I don't know the specifics of the case. I don't feel qualified to weigh in on the specifics of this particular case, but suffice to say, Minister Sajjan has my full support, and these are difficult situations. Clearly, the Prime Minister's made a commitment to strengthen supports and processes for people in the Canadian Armed Forces. And of course, I share the Prime Minister and Minister Sajjan's deep abhorrence for any woman's experience of harassment or violence in the workplace.
Hi, Minister. Louis Blouin here from Radio-Canada. The question for Minister Hajdu about proof of vaccination and vaccination passports for domestic use. What can you tell me about what is being considered right now about that? And do you have any worries? The Prime Minister spoke about equity discrimination for a domestic passport. What do you think about that? And what is being considered right now? What is the reflection of the federal government is about?
Merci pour la question. L'enjeu de passeport pour vaccination est un vrai enjeu. Mais for me as a federal health minister, I'm focused on the conversations that international partners are having around vaccine certification as a requirement for international travel. Of course, we believe that Canada needs to be part of those conversations. First of all, to have influence at those tables in terms of how that might unfold, but also to make sure that Canada is not left behind if the world embarks on a new requirement for international travel that requires some form of health certification. And so it's very important that we're involved in those conversations. I share the Prime Minister's concerns, though, around passports or some proof of vaccination for participation in everyday life in Canada. Obviously, there are settings where vaccination is required already to participate. For example, schools and certain healthcare settings, people must show vaccination against certain illnesses. And those are all largely provincial decisions. And of course, they're very difficult ones, but certainly I know provinces and territories are deliberating about those kinds of decisions that are coming their way as more people become vaccinated.
Is there not a risk that we end up with a patchwork in Canada where businesses, cities, provinces would have different approaches regarding to vaccinal passports? And what does the federal government can do? Can we prohibit that kind of passport in Canada? Could the federal government do that? Et Monsieur LeBlanc, n'hésitez pas à vous en mêler si vous voulez en français.
Please dive in if you wish to.
I'll start in English and then Minister LeBlanc can help me out in French. The federal government currently doesn't interfere in provincial decisions around, for example, vaccinations in provincial school boards. This is a very common example that maybe many parents across the country will relate to. In order for a child to be registered for kindergarten classes, for example, oftentimes, and in fact, most times, families must show proof of vaccination or some reason why that child cannot be vaccinated. And of course, that's to protect children and their families from common childhood illnesses that used to be far more endemic and of course, very dangerous to children and their families. So these are decisions that provinces and territories take on a routine basis. In terms of participation in everyday life, again, the federal government obviously leaves many of those decisions to the provinces and territories where rightfully so they have the jurisdictional authority and responsibility to make those decisions.
Oui, si vous me permettez, Anne-Clara, je pense Patty Hajdu a bien expliqué que la question des attestations de vaccination, preuves de vaccination, sont déjà des questions qui se posent dans des provinces et des territoires, que ce soit dans le milieu scolaire ou autre. Alors, c'est proprement une discussion que les provinces devront avoir en ce qui a trait au niveau d'attestation ou de confirmation de vaccination dans le contexte de COVID. On parle évidemment, comme le Premier ministre a mentionné il y a quelques moments, du contexte domestique. Nous, comme gouvernement national, nous allons s'occuper des conversations à l'international avec des alliés, évidemment, l'importance des États-Unis, puis avoir une cohérence en termes de traverser les frontières avec les États-Unis. C'est le genre de conversation que, comme gouvernement national, nous aurons au cours des prochaines semaines et prochains mois afin d'arriver à la réponse équitable et appropriée.
Hey, good afternoon. My question is for Dr. Tam. My name is Mal Hamidi. I'm with the Canadian Press. You keep saying that every Canadian that wants a vaccine is going to get a vaccine by September. But the chief medical advisor says it's unlikely that vaccines will be approved for kids under 12 by then. So why are you saying that?
Sorry, it's not just me saying it. It's for anyone who's authorized, of course. to get it. Anyone who's eligible, authorized, and want to get it should be able to get that vaccine by end of September. We will get more data from vaccine manufacturers in terms of the clinical trials in younger people, and that would be expected later on in the year. So I think you just have to unpack what that sentence actually means, but nobody's going to be provided with a vaccine that isn't authorized for use in those age groups.
Thank you, Dr. Tam. I think this is what ends today's presser.
Thank you. Merci. The conference has now ended. Please disconnect your lines.